IRMC.com.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160. Happy that you're with us here this morning. Our conversation with Dr. Athanasios Stoyioglou is brought to you by Marcus & Mack, a law firm representing injured people. Interventional cardiology at IRMC. You've been hearing a lot about it lately, and we're going to learn about it here this morning. Good morning.
Good morning. Thanks for inviting me here.
It's good to have you with us here today. Interventional cardiology, since it began at IRMC a few years ago, is something that is really not only just taking hold, but it's taking off. It's really a good program, and we're so happy that you've joined it. It's good to have you with us.
Yes, I'm very glad to be here. Yes, it's an excellent program. It started, I think, in 2016, 2017. It's a collaboration with Butler and Indiana Regional Medical Center. So Butler provides the support and the surgical backup that is necessary for a program that does not have on-site surgical backup. So as we know, there's no... we don't perform coronary artery bypass graft surgeries at Indiana Regional Medical Center. So, but we're allowed by the state to perform stent procedures to treat heart attacks or patients who are in urgent need for revascularization of the arteries of the heart. Now, the program also has an advantage because it offers solutions to heart problems for the aging population in our community who doesn't have the means or doesn't want to travel long distance to reach tertiary centers like Butler or Pittsburgh. Yeah. So that's another advantage, and but the most important thing and why the state is approving these programs is that when it comes to heart attacks, time is muscle, that's what we say. So the faster we open the artery, the better for the heart, the better the outcome is.
Yeah. It's interesting to me because we think of the convenience of not having to go a long distance to get a procedure done. And yes, that's important, but you just said it. The speed at which you're getting it done and you are getting treatment for whatever has happened to your heart, that's the really important thing, isn't it?
That's the most important thing, and that's where Indiana Regional is like a champion when it comes to how fast these arteries are opened. So that's actually quite well recognized. We measure what we call the door-to-balloon time, and our door-to-balloon times are excellent.
Yeah, well, that's terrific news. The program itself, of course, as you mentioned, has been set up now for a number of years, but to watch the way that it has not only been established but has progressed is just amazing to me. And the way that the team actions, it really is a team that comes together to perform these procedures, the stent procedures, isn't it?
Yes, absolutely, and that's very important. It's not just the operator, the physician. We have nurses and technicians that come in and assist with monitoring the patients, providing the necessary equipment that is needed for the procedure, and of course assisting during the procedure. So definitely it's a teamwork, and the cath lab staff right now has excellent training. I was so impressed to see how well trained they are and how efficient they are in their tasks.
Well, you come to Indiana, and you come with your experiences and your backgrounds with other medical teams, other medical facilities, and there is a natural inclination to compare. Is this one better? Is that one? Do they do it differently? What's the quality of the work that you're getting into and with? And so I'm assuming that you look at this team and you say they're on top.
Absolutely, yes. I can only praise them, yes. And that reflects on how well the program was established on the first place. How important the association is with a tertiary medical center that provides the logistical help, also the experience. So Butler definitely assists in that regard. Mm-hmm. But the team is very well organized and extremely, and I can say only the best about how they performed with their work. Yes,
and the facility is first rate.
Yes. It's I mean, for me, it was like a transition, a very easy transition. Everybody was welcoming, and I can trust and I can perform even complex procedures without any hesitation. Yes, that's very important.
All right, so we're talking about heart attack, which is the way that we refer to it most commonly. But there are other terms. Myocardial infarction is what we're really discussing here this morning. When someone is, well, let's do this. Let's start with prevention first, and then when we get to what actually happens when you have a heart attack. So, preventive steps to forestall or hopefully prevent ever have the need for a visit to the cath lab. Obviously, you want to do that. You want to be as healthy as you can be.
Yes, absolutely. So, I mean, the guidelines are well known. It's just difficult to implement.
Sure.
So, no smoking, healthy lifestyle. That means exercise. So, it doesn't have to be a tremendous amount of exercise. Just 10 minutes brisk walking 3 times a week. That makes a big difference. It's much better than no walking.
Sure.
And it's always better when we try to implement changes in our behavior to try to achieve small steps in the beginning. Mm-hmm. Okay? And we also need to kind of enjoy what we're doing. It doesn't have to be under pressure. So instead of trying to achieve 45 minutes of intense exercise, let's just do 10 minutes of brisk walking that we enjoy. Mm-hmm. And we go from there. And then later we can progress and escalate the amount of exercise.
Absolutely.
So the diet is very important also. Nowadays, we used to say that the most important thing is to have a low-fat diet. But nowadays, we think that the major enemy is carbs.
Oh, yeah.
Yes. So we have to cut down on, spaghetti, noodles, rice, white bread. Anything that is white mm-hmm. is not good, unfortunately.
No.
It's not completely excluded from our diet. It's just cutting down on portions. Yes.
Yeah. Very, very important. Even at that, someone who's living a healthy lifestyle can have a heart attack.
Yes, and that's unfortunately, yes. People can have what we call like minimal cholesterol built up in the arteries, like maybe 40% blocked arteries, just 40%, and then suddenly this build-up, this plaque of cholesterol, can rupture. And that can attract clots, and that can create a heart attack.
Yeah.
So heart attacks, sometimes they don't always happen when the artery is blocked 90%, mm-hmm. 95, 100% of the time. Heart attacks can happen with just a 40-50% blocked artery that the plaque, the cholesterol buildup, suddenly ruptures. And that's what we're trying to prevent, and we have medications that can prevent this rupture from happening. Mm-hmm. So the main medications that we use for primary prevention for people who never had a heart attack or who don't know, who are not aware that they have coronary disease, is the use of statins mm-hmm. and a little bit controversial nowadays, the use of a baby aspirin. Mm-hmm. Okay, so. The statins are the major medication that we have for primary prevention, and which we're trying to, to assess the risk of heart attack by calculating different, by taking into account different parameters like cholesterol level, age, gender, history of diabetes, blood pressure measurements, and if we assess that the risk is more than 7% or 10%, within the next 10 years for a heart attack, based on these models that are provided to us by the American College of Cardiology, then we do try to start treatment with a statin.
Yeah.
And statin treatment is the mainstay of the main way we prevent heart attacks.
Probably the first step that we talk about then is your primary care physician, who's going to monitor that and help you to see what the signs are and help you to go down that road. But even at that, you might feel that chest pain, or you might feel pain in some other part of your body. And you're wondering, well, should I go to the hospital for this, or is this something that I need to just watch for a while? What are the signs or the symptoms that we might have that should get us to the emergency room quickly?
So, the most important thing when it comes to symptoms is chest pain that comes with exertion. So that's the typical chest pain coming from the heart. So when we exert, when we climb stairs and we have chest pressure, and we stop and the chest pressure goes away, then that's a big red flag. Okay. So a lot of times chest pain can be related to muscles in the thoracic wall, like in the chest wall, being overstrained or overstretched, or it could be related to reflux disease or heartburn from the esophagus and the stomach. But usually, if the chest pain occurs at bedtime, we assume it's heartburn. Okay.
Sure.
But if it happens when we climb stairs, when we exert, when we push the cart in the grocery shop, then that and it goes away when we sit down, and then that means that probably indicates there's a problem with the heart. Yes.
Yeah. All right. So those are some of the things that we look for. We hear about things like pain in the arms, pain in the lower back, things of that nature as well, being signs that you ought to get something checked out. Especially when those risk factors go up by age or by activity level, weight, and those sorts of things. Wanted to ask you about with the entire program at IRMC, the interventional cardiology program and the cath lab. Are there specific goals that you look for? We want to grow to this, or we want to be able to do that within that program itself, or is it just a matter of let's refine what we do, let's review what we do, and make sure that we're always doing the absolute best that can be done?
We want to offer complex, interventions, percutaneous interventions, and try to not refer our patients for open heart surgery all the time.
Sure.
So we're trying to give the patients a second option. It's not just open heart surgery. We can maybe treat advanced disease with stents, and that will be a target for the future. And we can treat that locally, and that will be, I think, a service for the community. Yes.
He is Dr. Athanasios Stoyioglou visiting us this morning. Interventional cardiology at IRMC is a growing program, but it's also already at the very top of the field. I want to thank you for coming in to visit with us today.
Thank you so much. Thanks for having me.
Appreciate it.
It's a pleasure.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.